Hello, everyone. I'm Kelly Lenvoy from Arthritis Consumer Experts. And on this episode of Facts Friday, we're pleased to welcome Dr. Neda Amiri, Clinical Assistant Professor of Medicine, Rheumatology Division at the University of British Columbia. Dr. Amiri is also the Director of Pregnancy and Rheumatic Diseases Clinic at the Mary Pack Arthritis Center in Vancouver. Dr. Amiri, how are you today?
Hi, Kelly. Thanks for having me. I'm doing well. How are you?
I'm doing well as well, and we're really happy you're able to join us. And I guess the first question, as being not just a researcher but a clinician, what has life on the front line been for you, treating patients during the pandemic?
I think it's definitely been a period of adjustment for myself and my colleagues, like the rest of the population. As the Rheumatology Division here at UBC, we've been fortunate in that it's been a relatively easy transition for us to see our patients through other means other than seeing them in person, such as telemedicine or phone consults. We had already started doing that as of a few years ago, so it's been a little bit easier. But it's not the same, we definitely don't get the chance to examine the joints and see how much swelling there is. Patients send photos of their rashes, but the resolution is not the same. So it could have been worse, but we're adjusting and we're doing the best we can. I think it's been harder for our patients. Not only do they are dealing with things like isolation and loneliness, they don't get to come in to see their doctors to somehow to talk about some of those issues. I hear from a lot of my patients that they've either been laid off or they've lost their jobs. So it's a challenging time for everyone. And although on Instagram, people may see their friends and family who are baking breads and picking up new hobbies, I think that everybody is going through a difficult journey in their own way. And we're all trying to do the best we can given the circumstances.
And I think certainly one of the challenges as well is for patients to be getting good, credible information. I mean, what we're seeing this week is health experts who are feeling compelled to refute spurious claims about ingesting disinfectant as a remedy for COVID-19. So, once again, showing us how important it is that patients get the facts, understand the science, and receive clarity about the pandemic and what it means for them.
Mm-hmm.
So with that in mind, we'd like to get your perspective on a number of questions that patients are asking us about practical day-to-day best practices. And some of this information is fluid. That the first question about masks. So 2 months ago, we were told we don't need masks, and now the CDC in the United States, for instance, is recommending that we all should be wearing masks if we go outside. So I guess to start, should I be wearing a mask?
Kelly, you touched upon a very important point, and that is that although the information is fluid, we should refer to trustworthy sources. And although it may come from sometimes some of these claims from people who are in position of power, it may not necessarily be true. And obviously our motto in medicine is first, do no harm. So, we know ingesting disinfectants will definitely harm you. So yes, obviously we should not be doing that. So coming back to your question, should we wear masks? Again, depends, what jurisdiction you look at and what country you look at. You're correct that in Europe and the United States now it's being recommended that people wear masks when they go outside. And when we talk about masks, there are different kinds of masks, right? So there are the homemade masks, things like scarves that you can use to cover your face. There are the surgical masks that we use in hospital when we see patients. And then there are respirators, so things like N95, N100. So in terms of using the mask, using a simple mask such as a homemade mask, If there's no harm in essentially using them, but what you're trying to do by wearing a mask is protect other people when you wear the mask, rather than really protecting yourself, because obviously it's not uh, filtering out the particles. It's not an N95 if you're exposed to the COVID. So the idea is that if you have COVID and you're asymptomatic, so you don't have any symptoms, and so you're not aware that you're spreading the virus, by wearing that mask, you would limit the spread of the virus to other people. Just so in case, you sneeze or you cough, that the virus particles won't be able to travel as much. And then, some people say that maybe it's a reminder that if something is covering your face, that maybe you should not be touching your face. So it's an easy thing to make at home, and we're talking about just simple masks. Then I would say sure, there's no problem. And I believe Dr. Teresa Tam said that yes, we should be wearing masks, especially if we're going places that are a little bit more crowded, like grocery stores, to try to limit the spread of the virus.
Here in Canada, certainly one of the places people can go is, first of all, listen to those daily news briefings if they're occurring in your province, listening to your provincial health officer, but also going to the websites, whether it's Health Canada or your provincial health authority. And certainly one of the questions that we get, because patients are staying at home, they're getting a lot of things delivered to them. Should I be concerned about mail or packages or the newspaper possibly infecting me?
Yeah. So again, this virus hasn't been around for that long. So there's a lot still that we need to know about this virus. And like you said, the information seems to sometimes change daily. As it stands right now, it does appear that the virus can live on surfaces for hours, if not days, particularly on things like metal. The virus can last up to 5 days, whereas on paper or cardboard, it appears that it lasts about 24 hours. So there are a few options. If you are, so a lot of, if not all of the delivery services are now trying to practice contactless delivery. So as opposed to you receiving the package, they will leave it at your door, and then the person leaves, and then you can pick it up. So that's a good practice to start with, to make sure that we don't touch each other's hands. And then as to how to proceed, if you have the room or space, you can, I know some people are leaving the cardboard out in their garage for 24 hours, so that it reduces the chance of the virus living on the surfaces. Or another option is that you can bring in the packages, open up the packages, try not to touch anything, and then you can disinfect the surfaces of whatever you got, and then wash your hands at the end. Again, when we're talking about this virus, it's a game of chance we're playing. So if you want to be 100% safe, you should not be going out, you should not be touching anything, and really you should not be breathing. But we're trying to be practical and do what we can to really minimize our chances. So the best thing would be, yes, the virus can last. So these fomites, it's a low risk, but the risk is there. So you can just disinfect after you use, and disinfect your hands and wash your hands after you open the cardboard. And you talked about newspapers. So I know a lot of publications are actually stop paper production because of this risk. But for now, I would say maybe just stay away from reading the newspaper and refer to your phone reading online.
Patients are staying at home, patients are practicing social distancing. One of the few times they're going outside is to get groceries. And one of the questions we get from our membership is, after they go for a visit to the grocery and bring back their goods, should they change their clothes and shower when they get home?
So depends what the grocery environment looks in your hometown. Most of the places right now, if not all, again, are especially at the checkout lines or entry to the grocery. They're recommending that people are 2 feet up, or 6 feet apart, 2 meters apart. And only certain number of people are allowed to enter the grocery store, and both to protect the customers and the people who work at the groceries, is that there are things like plexiglass, right? Um, but yeah, so groceries can get a little bit crowded. For the most part, it should be fine. But you have to be, again, really careful. What did your clothes touch? Are you touching the handles of the grocery cart? So again, coming back, hand washing is extremely important. So washing your hands after you come back from the grocery, and then cleaning out the doorknobs, right? The metal doorknobs. Again, we talked about metal is the one where the virus can live the longest. And then unfortunately, some of our pieces of clothing can have things like metal, like zippers and buttons and stuff like that. So if it's just, your coat that may have touched things, you might be okay just putting that away and only wearing it when you go grocery shopping. If you want to be extra safe, yes, you can, change your clothes. Probably taking a shower, again, that might be excessive, but if you want to be extra careful, by all means, do take a shower as well.
Our patients living with autoimmune disease, their health is a very precarious balance. They're also very in tune to their bodies. They listen very, very closely to what their body's telling them. If they think they're feeling sick, that something's not right, and if they think that some of these symptoms might correlate to the virus, what should they do?
This virus is a bit tricky in that, again, if patients may have the virus and be completely asymptomatic. Some people just get a little bit of nasal congestion and they get a bit of headache. Some people have, full on flu symptoms, cough. Some people just get a skin rash. So you're absolutely right, and maybe in a way our patients are lucky in that, we've always told them, well, tell me about your morning stiffness, tell me about your joint swelling. So they always listen to their body and make mental note of those symptoms. So first and foremost, I self-isolate. So, no more grocery runs. If you live with other people in the house, try to limit your presence in one room, separate bathrooms. We've seen the consequences of people, chalking up their symptoms to just allergies, if it's just a bit of a runny nose, and going to work and causing an outbreak. So not going to work, absolutely, that's very important. And then call your doctors. In Canada, we've been lucky compared to some of the other countries, and we've done a better job of trying to flatten the curve. And given this, we have now more capacity to test patients. So patients need to know that their doctors are working. So we may not be able to see them in person, but things like, again, Zoom or telemedicine is available. They should get a hold of their doctor. Or there are things like 811, the nurse's line, that they can call and describe their symptoms, and then they can be guided as to where they can go to be tested. But right now, given that we haven't seen that exponential rise, luckily, in our cases in Canada, we have the capacity to test more patients. Again, I just want to acknowledge that this is a very difficult time, and I can imagine that our patients, especially those who are on immunosuppressive medications, are very scared. We don't know too much about what happens to our patients with rheumatic diseases who get the disease, but overall, we get the sense that they're not too bad and they're doing okay. We have a group of doctors here at the UBC division, and we check in every week, and we don't hear a lot of, oh, I have so many patients that are getting sick. So overall, at least anecdotally, it seems to be okay. And then this is an active area of research. So there's a global registry right now looking at what happens to patients with rheumatic diseases who do get COVID. We are participating here in BC as well. So, if you do get COVID, regardless of how severe your patient and how severe your disease is, please let your rheumatologist know. so they can enter you in this registry. It may not benefit you directly, but it does contribute to our understanding of how this virus affects our patients with autoimmune diseases.
Thank you again, Dr. Amiri, for sharing facts today with us. We really appreciate you taking time from your day. And I want to welcome and please join, tell our members to please join us next week for our next episode of Motivation Monday on Arthritis at Home. Thank you very much.